Hello to all of you members of this very important action group that's meeting here today. In my view, this is the flagship human rights action group within SHRC. The reason I say that is because it's the only one that is not being co-convened by the Scottish Human Rights Commission, and that is excellent because the Commission's role with SHRC has been very much the midwife, and I do now feel as if SHRC is beginning to have its own identity, its own personality, and be shaped by those who are best placed to do that in Scotland. And looking at the list of those of you who are there today, I have every confidence that you will meet that challenge. It's also one of the most, if not the most important area of SHRC because of the impact it has upon the ability of people to live lives with human dignity. Health and social care goes to the core of people's ability to lead the sort of life which is what we're entitled to as human beings. And we all know from our own experiences that that's not the case today, and that there needs to be a culture shift. My own experience is my mother when she was in hospital. I would go in to visit her each night, and I would check what kind of previous night she'd had, and I was told that she'd been found on the floor at 4 o'clock in the morning, that she'd kind of freed herself from bed where she had been wired up with all kinds of things that she needed, but which had agitated her, and we all knew she was wanting to get out of bed. So when I asked how on earth this had happened, that she could have died there on the floor, I was told that nothing could be done because it was our human rights. And I said, I thought I was being wound up here, but I was explained that she's got the right of liberty. And I said, well, she's got the right to life, and you have to protect that right. That's fundamental. Could you not have bars on the bed or a sense pad or something? And the answer I got from the nurse, who well-intentioned, was, I couldn't really do that, Mr. Miller. That's a matter of policy, and it would take a week or so. I'd have to go upstairs to get the okay for that. Now, I'm not saying this was just some inadequately trained nurse, because I have the utmost respect for the staff that looked after my mum. And I also had another experience with a consultant, much more senior level. When I first came in to visit my mother, he took me aside and said, how much should we intervene in your mother's care? I.e., should we resuscitate or not? And I said, have you asked my mother? You know, why are you asking me? My mother's perfectly capable, perfectly lucid, and has the capacity to tell you what she wants. So it's these kind of experiences that we all have that indicate that there needs to be a culture shift. Laws and policies which are going through now are very, very helpful, but the outcomes will be delivered by those who work in the health and care system, the staff. And I would like to emphasise that workforce development really has to be given a priority. I'm very happy that you're all gathered here today. SHRC is being recognised internationally, as Shelley will say, as best practice, because it's applying the panel principles of the UN in a model way. And as you know, that means participation, accountability, non-discrimination, empowerment, and legality. So I'm very confident that in the capable hands of Audrey and Margaret, and supported by people such as Kath and Shelley, that all of you will have a successful day today, and I look forward to hearing about the progress in the months and years to come of the implementation of SHRC. Best wishes to you all.